I want to apologize if there may be poor camera quality today. Dr. New Guinea is here with us via webcam. He is here to help us today with the real science behind addiction, focusing today on smoking. Here with us today we have Dr. Anthony New Guinea, an alumni and also currently a professor at Johns Hopkins University. Dr. New Guinea has a PhD in behavioral analysis and an undergraduate minor in neuroscience. Doctor, we really need your help and expertise on smoking addiction.
I would like to explain how smoking works in the brain and how it affects the body. Now, smoking is the activity of breathing smoke in from cigarettes into your mouth and lungs. Cigarettes and other forms of tobacco like cigars, pipe tobacco, snuff, and chewing tobacco contain the addictive drug nicotine. The drug nicotine is readily absorbed into the bloodstream when tobacco product is chewed, inhaled, or smoked. Now let's break down what exactly is in the cigarette that you're smoking. There is tobacco smoke that is a complex mixture of chemicals such as carbon monoxide, tar, formaldehyde, cyanide, and ammonia, which are carcinogens. Carbon monoxide is the smoke. It increases the chance of cardiovascular disease. Tar is the actual particle residue left behind. It exposes the user to increased risk of lung cancer, emphysema, and lung disorders. When the nicotine enters the bloodstream, it stimulates the adrenal glands to release the hormone epinephrine, or as many would call it, adrenaline, which stimulates the central nervous system and increases the blood pressure, respiration, and heart rate. Now, epinephrine is a neurotransmitter that triggers our fight or flight response. That is released when we feel strong emotions like fear or anger. Now, how does this affect the brain, you say? The nicotine itself increases the levels of neurotransmitter dopamine. Now, dopamine affects the brain pathways that control reward and pleasure. Non-stop nicotine exposure results in addiction and is addictive. It can be toxic if ingested in high doses. Of course, with every drug, there are withdrawals when trying to quit. Withdrawal symptoms by trying to quit smoking will include irritability, attention difficulties, sleep disturbance, increased appetite, and craving for tobacco. Now, not only do symptoms come along with attempting to quit this addiction, but there are also diseases that arise from smoking. These are such as increased risk of heart disease, strokes in the brain, heart attacks, vascular disease, and aneurysms. Now, besides cancer, smoking can cause lung disease like chronic bronchitis, lung disease that makes it hard to breathe, emphysema, damage the air sacs in your lungs, making it harder to breathe. Now, even though nicotine is indeed addictive and toxic if ingested in high doses, it does not cause cancer. But other chemicals along with it are responsible for most of the severe health consequences for tobacco use. As with many drugs, the body builds up a tolerance to nicotine. Smokers start to need more nicotine to get the same effect. They usually end up smoking more often to get the same nicotine high. Nicotine tolerance builds up quickly over the course of the day during continuous smoking. The metabolic tolerance takes place in the liver, and some drugs like nicotine cause enzyme induction, which means increasing the enzymes produced by the liver. For example, chronic smoking results in nicotine being broken down more quickly, and as I mentioned before, the smoker needs more cigarettes in order to get the same effect. Excessive smoking can cause permanent change in reward symptom neurons. This results from increasing drug tolerance, a process of accelerating change that makes the reward symptom less efficient and requires users to take more of the drugs to obtain the same high they usually get from less. Tolerance alters brain cells physically, changing their functions. Eventually, as the tolerance deepens, it alters the nature of the drug-using experience from liking the drugs for their euphoric effects to needing them simply to feel normal and hold off withdrawal. Let me try to explain why smoking addiction is resistant to treatment and why smoking is an extremely hard addiction to break. There are two terms closely associated with addiction. One that I would like to put some more light on today is classical conditioning. The second term, but no less important, is operant conditioning. To put these terms simply, Classical conditioning is a reflective process and does not require any higher order of thinking and or cognition. Operant conditioning requires cognition. Classical conditioning is a representative case in which an organism learns to associate two events and therefore provides a rigorous method for studying associative learning. Pavlovian conditioning is always occurring in our lives. It affects on how behaviors have important implications for understanding normal and disordered behaviors in humans. Pavlovian and operant conditioning are usually studied separately, but outside the laboratory, they are almost always occurring at the same time. For example, a person who is reinforced for smoking excessively learns these behaviors in the presence of certain stimuli, a pub, a set of friends, or even a restaurant. These stimuli are also available for associations with the reinforcer. In this way, Pavlovian and operant conditioning are always intertwined. The reason that smoking seems so resistant to treatment is because smoking is almost always associated with another behavior, such as after dinner you smoke a cigarette. The two behaviors are occurring at the same time. Through counseling, you are encouraged to change old negative habits previously associated with smoking, such as no longer smoking at your favorite pub or restaurant. Those things may seem easy to change. You can stop going to your favorite pub. You can find a different restaurant. When your smoking addiction is associated with eating, that connection between eating and smoking may be much more difficult to break, because you can't just stop eating to break the association. If after every meal you have always smoked a cigarette, you are associating the two behaviors, and one of those behaviors is not something you can control. How can you separate the associations of smoking after every meal when eating is necessary? Now first, tobacco dependence is a chronic disease that often requires repeated interventions and multiple attempts to quit. One of the first ways, and in my opinion one of the most important ways to persuade nicotine addicts to stop, is to allow healthcare providers to educate their patients who are active smokers on the negative effects it has on the human body. Now, you may say, well, Dr. New Guinea, there are thousands of commercials out there that say just that. And I can tell you what, you are absolutely right. But you can never hear enough information regarding your health, especially when it comes from an in-person educated healthcare provider. Now, pharmacotherapies and either in-person, telephone, or group counseling are two effective evidence-based treatments for tobacco dependence. Now, medications are usually the most known form for helping with any type of addiction. For nicotine dependence, there are 7 first-line medications that reliably increase long-term abstinence rates, 4 of which might be a little bit more familiar to the general public. So 1 of which is nicotine patches, 2 nicotine gum, 3 nicotine inhaler, and 4 nicotine nasal spray. Now these 4 types of pharmacotherapies are constantly being advertised on television and are proven to be effective. Now, allow me to take one of the 4 types of medications that I just stated to you and explain more in detail what it does. Nicotine gum. So nicotine gum works by giving you a small amount of nicotine, but without the dangerous effects of inhaling tobacco smoke. The nicotine released from chewing the gum is absorbed into the bloodstream from the lining of your mouth and provides quick relief to your cravings. Now, over time, the amount of nicotine that you're consuming from the gum is far less than that of the cigarette and will cut down on cravings little by little. Now, support and encouragement are 2 very important vocabulary terms that are essential in stopping addicts or assisting in stopping someone's addiction habits, and counseling can do just that. Now, counseling sessions can help patients to identify triggers and behaviors that may be related to their addictive habits, such as being in a casino where it's common to see smoking occur, or knowing that when stressed out, you tend to want to veer towards smoking a cigarette. This form of treatment can really amplify the effects of medication by teaching about stress management, as well as refusal skills that they can practice in treatment, social, and work settings. Now, even though I discussed these 2 types of treatments separately, combining these treatments is extremely urged. Counseling and pharmacotherapy treatments are thought to operate by different yet complementary mechanisms that have positive effects. Pay attention, Bill. Now that you know how smoking works in the brain and how it affects the body, you understand that there are changes associated with the addiction. You also understand that tolerance plays significant roles in someone's addiction habits and why the addiction may be so resistant to treatment. But through
Thank you so
medications
much,
and
Doctor, for your
behavioral
time and
therapies,
help.
you can
I
fight
know how
and
busy your
reward
schedule
incidents.
must be, but Dr. Phil and his staff really needed your expert advice to help him with their show. Please know that we are grateful for your time and vast knowledge on smoking.